Hello, everyone. My name is Omar Awan. I'm the Associate Vice Chair of Education at the University of Maryland School of Medicine. I want to talk today about which mask should I wear. It's during the COVID-19 pandemic. A lot of people have asked me about masks. There's a lot of confusion about masks. So I want to sort of demystify the most important types of masks that the CDC has recommended to give us full and most optimal protection from COVID-19. So the CDC recommendations has recently updated their guidelines. They recommend high filtration respirators. They offer the best protection against COVID-19. And what is a high filtration respirator? Well, it's a mask that uses static electricity to trap airborne virus particles, right? So it offers the best protection that we know of against COVID-19. There are three major types that are available in the United States. That's the N95, the KN95, and the KF94 mask. And I'm going to go over some of these very briefly as to what they look like and how they sort of work. So this is a typical N95 mask. Okay, offers the best protection according to the CDC against COVID-19. Notice that there's two straps. One strap goes over your ears. The other one goes below your ears. So it has a very nice tight fit. And that's why it offers the best protection against COVID-19. It has a nice snug fit around your nose and your face. If you're wearing it properly and you have glasses, your glasses won't fog up. That's how you know you're wearing it properly. And the 95 comes from the fact that this is 95% effective in filtering or catching airborne particles. That's what we mean by 95. And this is made according to a US standard. So this is made according to the National Institute of Occupational Safety and Health Standards, and it works very effectively. Please note that these are not available for children. So there's no N95 for children. If you see an N95 for a child, it's likely fake. Okay, so this is what a typical N95 mask looks like. A KN95 also has 95% efficiency or efficacy against airborne virus particles, and it's often a little bit more comfortable because you have these ear loops. These go around your ears. You don't have a strap that goes around your head or below your ears, and these are a little bit more comfortable, but they're not as tightly fitted as an N95, and thus it's slightly less effective. I know it's 95%, but the CDC has said that the N95s are better. They do have a tighter fit. I've worn both of them, and I can tell you for sure that the N95 fits more tightly. A KN95 is a little bit more comfortable, but they are approximately 95% efficacious against virus particles. This is made with accordance to the Chinese standard, okay? And these are available for both adults and children. The KF94 has 94% efficiency against trapping virus particles. This is made according to a South Korean standard, okay? And it also has ear loops, which makes it very comfortable to kind of wear around your ears. So this is a KF94. So I thought this chart would be very nice, right? Contrasting the three types of masks. So again, 95% for N95 and KN95, but KF94 is a 94% efficiency. They're made according to different standards, the N95 being a US standard mask, KN95 Chinese, and then a KF94 South Korean standard. The attachments are different. There are ear loops for a KN95 and a KF94, but remember that the N95, which is the best one, straps around your head and and below the ear, right? But it's not used for children. That's the key, right? We don't have N95s for children just yet. You can get these, according to the Biden administration, these are going to be available at pharmacies for free, community health clinics. If you don't want to wait, you can go to Home Depot, Lowe's. They all have these type of masks, particularly the N95s and the KN95s. The KF94s are a little harder to find. So very easily and readily accessible for the general public. One other question that I often get is, how often should I wear these masks? Well, healthcare workers shouldn't reuse them. Someone like me who goes into the hospital, I should wear it once and I shouldn't wear them again. But for the general public, I encourage you guys to use the 5 rule. So if you're wearing it all day, meaning for like 8 hours from 9 to 5, you should let it rest for 5 days and wear it only for a total of 5 times. So you can imagine if you're wearing one day on Monday, you'll wear another one on Tuesday, another one on Wednesday, another one on Thursday, and another one on Friday. And that can be a 5-week cycle. So the mask will last you about 25 days. Each mask will last you about 25 days, okay? It's helpful often to hang the mask to keep it cool, let it dry out to allow the particles to die off. You can put it in a lunch bag, one for each day of the week, one for Monday, Tuesday, Wednesday, Thursday, Friday. That's a nice way to sort of remember how to do it. And again, it's a 5-week cycle. So after 5 weeks, you should discard them. Now, if you're only using it occasionally, maybe for a couple minutes, 10, 15 minutes when you're going out to eat, or you're going to the grocery store, remember that the life cycle is really 5 days with 8-hour days. So if you're working 8 hours, that's 40 hours, right? So you should just be cognizant of the fact that that mask is only going to last for 40 hours of protection on your face. So that's a nice way to remember how often you can use it. So I hope that was helpful. Thank you so much. We'll do another great public health video next week. Tune in next week, and thank you so much for your attention.